It changed everything. You think that your life is headed in one direction, and then all of a sudden it gets thrown off. Dealing with loss is a lesson no one ever wants to learn. Conceptually, you can understand that losing a child is going to be awful, but it's not until you collapse in a heap of tears on the floor that you fully experience that. If you're going through that, know that you're not alone. We are now in this brotherhood of suffering, and it absolutely means you do have to advocate for yourself.
Hey everybody, welcome to the Sovereign Health Podcast. My name is Andy Schoonover, and we're on a mission to inspire radical personal responsibility for both the financial and physical aspects of your health. We get the joy of hosting thought leaders who are reimagining how healthcare is delivered. I'm excited. Today we have Dr. Mark Stephany. Dr. Mark is an author, he's an internist, he's a hospitalist. His book, Sovereign Health, is one of the best that we've read about the craziness in our healthcare system. You can find it on Amazon and other places on the net. Hey everybody, here I'm with Dr. Mark Stephany. He's the author of an awesome book called Sovereign Health. Goes into all kinds of incredible personal stories about what's going on in our healthcare system. And so I had an amazing conversation with him a few months back, and he and I have gotten to know each other a little bit over the last 6 or 9 months, did you say? Yeah, 6 or 9 months. And we've gotten to share a little bit about our stories, our love for healthcare, our love for Bitcoin. Is it love for healthcare, or is it just despising healthcare? I'm not sure which one it is, but it's our love.
It's the yin and yang.
It's the yin and the yang. And so we'll talk about healthcare a little bit today. But one of the things that I think we've bonded over, I'm not sure if bond is even the right word, but, shared experience that I'd love to kind of hear from you about, given, you are a doctor, you do come from this at a pretty different angle than most. Both of us have had loss in our lives. Back in, it was 2015. My wife and I had just gotten married and had a daughter. We found out at our 12-week ultrasound that our daughter had a condition called anencephaly, which in essence what that is the top of you probably know better than I do how to explain this, but the skull doesn't form properly. And, we found out at our 12-week ultrasound. She said the doctor said, terminate and try again. And for us, it was one of those where, we were going to give her life in whatever way that God wanted that life to look. And she ended up passing away about 10 and a half hours after she was born. And, that's kind of been an instrumental event in my life. And I kind of joke that her name is Grace. Grace has had a bigger impact in 10 and a half hours than I have in my 44 years. And I told you that story, and you shared a story with me as well through some stuff that you and your family have gone through. And one, I just so the audience know, I've asked Mark if he'd be willing to share this, and he said he would. So I'd love to hear just kind of your story of your family and kind of the kind of decisions you guys made through life. And then you decided that you wanted to extend your family. And so I'd love to hear your backstory on that.
Well, thank you for sharing yours, and thank you for saying Grace's name. I think that's incredibly important to acknowledge their life, and so thank you for doing that. It is undoubtedly the most impactful event of my life, and the decision to have a second child. We have one daughter now, and for the longest time, I did not want to have a second child. There were several reasons for that. Selfishly, I felt like I wanted to achieve other things in my life, and a second child and the time, the financial commitment to a second child would push that, would make that challenging. But then I started reflecting on that sentiment and thinking, well, I better achieve those things, and they would also have to be better more fulfilling than having a second child. But even that realization didn't sway me. I'm older. Going through this process. I was 41, 42, 43 now. And my father was older when he had me, and it wasn't necessarily the experience as a father-son relationship that I wanted. And so I didn't want to be an older dad. And so and then, COVID and the riots here in Minneapolis, and some other medical issues and other family issues arose during that time. So it pushed off having a second child for a while. But my wife still wanted to have one, and I continued to think about it constantly. But in fact, it was another Bitcoiner who was the final impetus for me to want to have one, and that was Andrew Bailey. He's a philosopher and has written on Bitcoin, and I was on the podcast too. And he was giving his last lecture. This would have been a year plus ago, to his students. And in that lecture, he just said the simple words of that his siblings were the greatest gift that his parents ever gave him. And that was enough to change everything for me, because I realized that my brother was the greatest gift that my parents ever gave me. And I could not look my daughter in the eye in the future and say that I did not try to give her that gift. And so that was it. And my wife and I started trying. We got pregnant 2022 in July. And everything was fine. Everything was going great. The ultrasounds looked good. And since my wife was high risk because of age, and then my current daughter was born at 35 and a half weeks. She was deemed high risk, which meant she got an additional ultrasound at 21 weeks. And in that ultrasound was December 3rd of 2022. Or excuse me, the end of November 30th or something like that. And everything looked fine, pristine. And we thought, this is wonderful. This is great. And
how many weeks was she at that point?
21.
Okay.
And then December 3rd, my wife's water broke. And I got a call from her at work. It's just like the trauma of having our daughter come early initially, we thought was bad enough. But then, the immediate thought was just, oh God, not again. And went down there. And because our daughter was at the age of 20, right between 21 and 22 weeks, she was on this cusp of viability. Being in a larger city, we had two institutions. We happened to be at one that could try to resuscitate a child at that age. That was an immediate, option. Whereas if we had been in northern Minnesota or, some other rural town, like it would have been just, the child would have passed. It would have been not an option. And so that became the decisions that we were faced with at that time. So her water broke, but she did not go into labor, but you're most likely to go into labor within the first week. And so she was admitted to the hospital on December 3rd. And we just waited. We waited and thought about all the options, talked to dozens of doctors, perinatologists, OBGYNs, and got their opinions on what to do. And, what it would look like if she were born alive, and resuscitative measures, and then what that would look like if she'd being in the NICU for months thereafter. And then what kind of life she would have thereafter, high risk for cystic, pulmonary problems, neurologic problems, and all these other things to contend with. And so just inundated with all these unknowns that you cannot quantify, that you cannot really put probabilities on. And I remember my wife taking one of the dry erase markers and just filling up all the dry erase boards in our room and on the window. It looked like something out of Goodwill Hunting, writing on the mirror with all these decision trees about where to go and what to do. If she were born today, what would we do? If she's is born in a few more weeks, if she makes it past kind of the 25-week mark, which is kind of a more ideal spot, what would we do? And it was a position that I could not have prepared for, that I could not have imagined at all in my life. And so we were in the hospital for 4 days. She didn't go into labor. December 8th is my daughter's birthday. And we wanted to go be with my daughter for her birthday. And so they let us out of the hospital on December 8th to celebrate my daughter's birthday. And my daughter, Celeste, was born on the next day, on December 9th. Mm. And I'd like to think that she hung on for those 24 hours so that she could let her sister celebrate her birthday. Yeah. And she was stillborn, so she died, going excuse me, through the birthing process. And so the decision was made for us. And, hearing her heartbeat in the few minutes before my wife went into labor, and then subsequently not, was incredibly hard. And then, much like you did, we just spent as much time as we could with her. Yeah. Her name is Celeste Jacqueline Stephany, and she was born December 9th, 2022. And yeah, it changed everything. And you think that your life is headed in one direction. And you've got plans and desires and wishes. And then all of a sudden, it gets thrown off. And there's not a damn thing you can do about it. And it's been incredibly hard since then, as you can tell. The hardest thing in my life for both me and my wife and my family and everybody. It changes everything. In the months afterwards, it's like entering back out into life, and everything seems new and foreign again. At least I didn't want to interact. People don't understand what you're going through, and they try to be helpful, and that's understandable. The sympathies and the support, rushes in, immediately, but then disappears, arguably when you need it the most, in the weeks and months later. And currently, my wife and I are trying again, but are faced with challenges in that capacity. And so we still feel in purgatory, where we haven't quite been able to move on, with either not having a second child or being pregnant. We're still trying to deal with the physical fallout of the original birth. So it's been awful. And, dealing with loss is a lesson no one ever wants to learn. It conceptually. You can understand that losing a child is going to be awful, but it's not until you collapse in a heap of tears on the floor that you fully experience that and know what it means and how it's going to shape the rest of your life. But it was very early on for me, and I only speak for myself, that I only saw 3 options. And that was to either remove myself from this world, to or to detach, mentally, emotionally from this world, or it was to use this as an opportunity for growth, to be a better person, to be a better father, to be a better partner. And it was an easy decision for me. I could not look at my daughter Celeste and think that she would want anything else for me or for my family, for her family, for my wife. That is the only way that I can see honoring her death, what she gave up, what we could not do for her. I just cannot imagine not trying to honor her.
Yeah.
In that way.
Amen. I mean, you said a couple times, I think it changes you. Everything is different. I mean, can you point to some things that say, I've this specifically has changed, whether my personality or outlook on life or whatever it may be? What are some things that have changed?
Yeah, several things. While at this stage in the game, there's still a cloud hanging over us. I still try. I'm trying to again see her in everything that I do, and so that means being more patient. That means being more kind. That means being more empathetic to people and their suffering. We are now in this brotherhood of suffering, or sisterhood of suffering and loss. And again, I see no other way of dealing with that than trying to ease others' burden. And so, since her death in the hospital, I feel like I'm much more present with my patients, and I want to listen to them and their suffering and their story, because that's ultimately, I think, what's most important to people. It's not necessarily the antibiotics that I'm going to give them, or other management. It's listening to their story. It's listening to their pain that they are in, and acknowledging that, and acknowledging their humanity. And so I'm trying to be better at that. Additionally, it's made me want to double down on my desire to create something incredible and special. And for me, that dovetails with my desire to to help prevent people from seeing me in the hospital, to, I don't want to say fix medical care, because that's not what I want to do. I want to prevent people from needing it in the first place, from needing the system that failed my wife and I, which is another layer of tragedy in this whole experience, which is worth mentioning because it is an exclamation point to our whole overall discussion about the healthcare system. I'm a physician. My wife is intelligent. She's smarter than I am. And yet we could not navigate this health system well enough to potentially have prevented the death of our daughter. And when my wife first chose to her OBGYN, she needed to find a new one because her health insurance was different for this child than it was for our daughter. And so she needed an OBGYN. She also wanted to have care with a midwife. But as it turns out, unbeknownst to us, if you want to get midwife care, you get shuttled over just to midwife care, and you're off basically OBGYN care for the majority of your prenatal care. And so that's what happened to my wife. She did have a preset perinatal visit. And during that perinatal visit, the perinatologist told my wife that she needed to be on estrogen therapy to help reduce the risk of premature birth, because she was at high risk for that, again, because of age and prematurity in my daughter's prior experience. And those recommendations from that perinatologist went back to the original nurse practitioner who had shuttled her off to a midwife and were never received. The midwife either did or did not see the recommendations, but either way said that my wife did not need this therapy. Somehow her recommendation trumped the perinatalogist. And so fast forward to 21-week ultrasound, that perinatalogist was looking at me and she says, "You've been on estrogen therapy, correct?" And we said, "No." And the perinatalogist looked at me, and as physicians do, looking at each other when we know that something's awry. And I was just like, fuck.
Man.
And so the use of that reduces the risk of premature birth in the situation by 20 or 30%. I talked to two medical malpractice attorneys following the death of my daughter, and they both said that, that's not enough to sway a jury. But then the one said to me, and I'll never forget it, she said, "What the hospital's attorneys will say you did not do was advocate enough for yourself." I was fucking livid. And she was just saying that as objectively as possible, that's the claim that they would lob at us, that I should have advocated more for my daughter. And I wrote a very pointed letter to the powers that be within my healthcare system that I work for, explaining everything. And when the dust settled and they did a look back on everything, they acknowledged that they made a mistake. But that's a mistake, that, are dollars and cents to them, but is the potential loss of my daughter to me. And so I know your anger towards healthcare. I know how frustrated you are towards all of it. And it absolutely means you do have to advocate for yourself, but sometimes that's not even enough. And so the only solution that you have, at least when it comes to chronic disease, is to prevent the need for it in the first place.
Mm-hmm. Yeah, it feels like oftentimes we are sent on a mission as a result of painful experiences. And it feels like you're on a mission to change healthcare in many ways. One, because you've seen it firsthand in both the practitioner side as well as the patient side. For me, it was one of those things where we were actually loved incredibly well by the practitioners. The doctors loved us extremely well. The nurses loved us extremely well. My daughter was born on May 21st. And so every May 21st, we go back and we go back to that hospital, go back to that hospital room. We bring the nurses, treats and things like that, just to say, thank you so well. Thank you so much for how well you loved us. And then there's this disconnect to me. It feels like there's this disconnect between the people who are caring for you on a daily basis, or when you're in the hospital, or people like you, like incredibly great people. Like you guys are underpaid and overwhelmed by what you all have to do. And so it takes an incredible person. From my perspective, I'm the son of a nurse, so maybe I have just a heart for folks who are in the hospital, who are caring for those individuals. But there's a disconnect between those people and then this just huge layer of bureaucracy and administration that seems to rule the roost, right? That makes all the rules, who, creates this craziness that has impacted you. And many people have heard the CrowdHealth story and how we got, screwed by my little one, not the one who passed away. I've been blessed with two little girls since, but why is that disconnect? And I don't want to maybe, and it's hard not to go to intent, but What is it from your perspective as a doctor who's in the hospital every day? What is going on here? Like, why are we getting our system being overrun with administrators? And I'm an MBA, I'm not a doctor, but MBAs. We're taking the power out of the hands of the nurses and the doctors and putting them in the hands of MBAs who shouldn't have that power. What is going on here? Like, why is this happening?
I want to first acknowledge the incredible care that my wife and I did get in the hospital during the almost week-long stay that we were there. In the nurses and the physicians that we had gave us the time, gave us the love that we needed, and I'm incredibly grateful for them. And that's a wonderful idea to return. And I will tell my wife that we need to do that this December. Where is the disconnect? It's carrying individuals within a system that does not optimize for that. The medical system that we experience optimizes for throughput, and that's how in procedures, and that's how they get paid. You can imagine the only way to think about what the problems are now is to think about an alternative system whereby under a different reality, right? And what I see that as strictly as medical care, not necessarily lifestyle interventions, but that system would be one where this what we call shared decision making, which is this idea of when a patient comes to a care provider, a physician with an issue, that the healthcare professional presents the information, the data, the recommendations, and then meets the person where they are at in their needs, and you come up with a shared decision making to move forward in that. That verbiage has been around for decades, but again, is not practiced because it takes time and it takes close relationships that are readily accessible. And that is not how the system currently operates. You want to be able to talk to your provider, without having to jump through phone trees. You want to be able to get an appointment when you need it, not in 6 months. And so it's carrying individuals who then butt up against a system that does not optimize for that. It's a disassociation between, again, customer service and then medicine as a product, and optimizing for the product. And that's the patient is the product in our current reality. They're not the customer, they're the product. And so as many of those products that we can sell and push them through, the better off it is for the shareholders.
Yeah, I mean, I posted a tweet, I think a couple weeks ago, that basically said, you work for who pays you.
Yeah.
And the doctors, the hospitals ultimately are paid by insurance companies, far and away by insurance companies. And therefore, they have to satisfy the needs of insurance companies to get paid, or else they're just not going to be able to get paid. The bills will not get paid if the insurance companies don't pay them. And so therefore, if your insurance company is your number one stakeholder, then it's not the patient. And I think it would be hard to argue that the patient shouldn't be the primary stakeholder if they're suffering from something, whether it be the loss of a child or a heart issue or whatever it may be. Like, that person should be your customer, but our system is not built on a direct to consumer model.
Right.
This organization doesn't have the same ramification if they treat you poorly that the local restaurant would, because the patient's not paying you. It's the insurance company that's paying you. Right. And so that ultimately is why we at CrowdHealth are like, look, this should be between the doctor and the patient, the nurse and the patient, whoever it may be. It should be the member paying the doctor, paying the nurse, whoever it may be. because that creates an incentive system for caring and empathy and all the things that you and I have needed through some of this, very tough thing. And that's where I think we can change this system in a big way if we can figure out a way to change the payment system. I also put a tweet up on, and I'm sure you've seen this chart too, where since 1970, the number of doctors have gone up marginally. Yet, the number of administrators go vertical. I mean, it is one of the it's one of those graphs that you look at and you're like, there's no way this is even possible. Like, how can this be possible? Fake news,
Yep.
but it's that bureaucracy is all those administrators and all the costs of those administrators that I really think has turned healthcare on its head over the last 50 years.
Yeah. And that's funny that graph has I've seen as wallpapers on many of computer over the years in the doctor's lounge, for the administration to see. So yeah. And again, it's all about, profit extraction. And it's, honestly, I have no idea how, the business of healthcare is profitable anymore, like where there is alpha, so to speak, in any of it, because it all seems so insanely, clogged, bureaucratic, and positions that why does this even exist? Why can't we do this more efficiently? And that's the problem, is that you have caring individuals with good ideas, and then they butt up against this Goliath of systems and bureaucracy that are just simply not designed to accommodate those types of ideas. Every year, as a part of our bonus structure, we have to come up with some quality care incentives. And I kid you not, we achieve them only for that initiative to die the next year. Like it goes nowhere. It's just a check box.
Right.
And it's just, it's so infuriating. And for many of us, you feel apathetic to it, that you can't change anything, because you can't. And that's, much like, Bitcoin's mission. If you want something to change, you have to build outside the system. And I don't see healthcare changing to any great degree within its current structure. And it's why companies like yours that I think are the ultimate disruptors in it all.
Yeah. The story you told, the story I've been able to tell, it humanizes healthcare in many ways. We kind of have this saying at CrowdHealth, fund humans, not health insurance.
Yeah.
We had a situation of, I don't know, it was maybe 4 or 5 months ago, where we had a family similar to yours that had I think earlier on in their pregnancy, a miscarriage. And the way that we operate is we actually let our members know that, hey, this is a family who needs help because with bills, related to a miscarriage. And I think we sent that one out to 100 people or something like that. And we had people come back and say, I've gone through that. I know what that family is feeling. Like, can I give more to them? Like, I know that you asked for $50, but can I give $100 to that family because I want to help them?
Right.
And so to me, it's like, how do we build a system where it's back to where it was 100 years ago, where, if Mark is going through this really traumatic experience, like the community truly like rallies around that person to love them well, and it's just hard to do in the digital world that we live in. But if I know that I'm helping, it's Mark or Andy or whoever, specifically, as opposed to putting it in this black hole of insurance bureaucracy, I think there's a humanization there that is really powerful and impactful. And we need to go back to that. Like, I feel like it. The insurance companies and the government, I feel like, oh no, we got this. Like, let us take care of this. And it separates me, the patient, from you, the doctor. And there's just, that's where I have problems with this whole system.
Well, for millennia, for centuries, that's all physicians had.
Yeah.
Was their comfort in their time, in their word, and because there were no beneficial therapeutics. It wasn't until I think you can draw a direct line between the advent of more beneficial therapeutics, over the course of the past century, and how that has in turn removed that empathetic element of the physician and replaced it with mechanisms and ones and zeros, and coupled on top of this very reductive approach to medicine of finding the single cause for X, Y, or Z disease, and we got to keep testing to try to figure it out, and more medications to try to treat it. We've lost that empathetic touch, which arguably has as much to do with healing as any medication that I can prescribe. We simply don't have the time, training, desire to do that anymore. I still firmly believe that I can be empathetic and as gracious and beneficial in the few minutes that I may have with somebody, and I need to honor that. But still, it's not the ideal. And you can only expect the results. The system that's currently in place is how the system is designed to get the results that it gets, right? And so I don't see that changing.
Yeah, I mean it really is. There's a biblical saying that says, "For the love of money is the root of all evil." And it is certainly that case within the healthcare system. From my perspective, because everything I've read in my history of healthcare, the local doc wasn't doing this for the big bucks.
Well, I think you can have both if you design a system as such, but we've had so many layers upon layers upon layers of ultimately infrastructure that it's not beneficial to the end product. Because again, if it were, we wouldn't be having this crisis of chronic disease that we're facing in the U.S., and we'd have better numbers to support it compared to other developed nations, and we don't. So clearly, we're doing something wrong, and I just think that if you're able to, I don't think it's necessarily money. I kind of disagree with that quote. It's like, what do you want? What do you want to do with that money? It's much like the critiques that are lobbed at Bitcoiners that we're just in it for profit. It's like that is an element of anybody's desire to have more Bitcoin or money, but it's ultimately what is driving. That's not going to get you very far. Ultimately, what do you want to do with that Bitcoin? What do you want to do with that money? It's the same line of thinking that I tell people when they want to improve their health, they want to better themselves. The first question you should ask yourself is, why do you want to make more money? Why do you want to be healthier? Why do you want to better yourself? And until you can answer that, you're never going to have enough money, or you're not likely to make sustainable changes in your health that are lifelong.
Yeah, and I think from my perspective, my for the love of money comment was much more focused on the way the government has enabled health insurance companies and pharmaceutical companies to reap the rewards of a fairly awful system. And I'm not saying this is about the doctors. The doctors, there's 1 million doctors. They make on average $300,000. That's $300 billion. Our system is about $4.3 trillion. So add benefits onto that. It's somewhere between around 8% plus or minus a percent. So I first heard that and I was like, that is almost impossible. How can only 8% of our dollars that we're spending on healthcare are actually going to the doctors who are treating us? it just doesn't make any sense to me,
Yeah.
but those are the numbers.
And we're always the first ones to get the pay cut, which I know no one's going to sympathize for, and that's understandable. But we're the easiest to cut our budget and our benefits and so forth, and like it's almost inevitable. And I told this to our C-suite several months ago. It's like we only represent 8% of the total spend. There's a diminishing returns there for your bottom line if you want to keep cutting our salaries. Like it's going to butt up against people just quitting, right? And so you've got to be able to be a little bit more creative. If you're doing what every other hospital system is doing around you, how can you expect to make any better profits or results? So I turned it around to them and I said, start engaging with physicians in the way that you would necessarily, some of the number crunchers in the MBAs. Like, we know where the waste is. We know where we might be spending or ordering tests that probably don't really need to be ordered, and things like that. And so start engaging with us with regard to profit maximization, cost reduction, because again, that's never, as far as I'm aware, ever been done. And so bringing us to the seat of the table, I think, is maybe one of the only steps that could potentially reduce some of the cost to the hospital systems. It doesn't necessarily speak to the insurance companies, but that suggestion just, again, kind of falls on deaf ears because it's so far out of the current model of thinking, and you're left with, again, some spreadsheet somewhere in the corporate headquarters of, we'll take the 8% down to 7% this year, and we'll cut some of the
penny wise, pound foolish is what they say. Well, Mark, as we kind of wrap up here, you've gone through some incredibly difficult things over the last 6 months. Is there any advice that you'd have for people who have loved ones in their lives that are going through what you and your family are going through? I think you kind of mentioned, like, everybody wants to help. A lot of times they don't know how to help. What is the best way for somebody to help, a family like yours as you're going through really hard stuff?
The realization that so many people have gone through this that don't talk about it. And for me, it was really the understanding that there's a whole spectrum of trauma that families, women experience, from miscarriages to the loss of the child, at term and thereafter, and all of those are traumatic and hard, and especially with earlier term miscarriages, we just kind of brush them off as it's likely to happen, in pregnancies, but those are really fucking hard still.
Yeah.
That's a loss of a child. And the loss of my own really made me recognize that. And so if you're going through that, know that you're not alone. It feels that way. And your friends and family aren't going to understand. If you have trusted individuals, friends or family who are there for you, double down on that relationship. But in my experience, it's something that people can't wrap their heads around.
Yeah.
And therefore aren't able to meet you where you are at in your pain and your suffering. And I've had to give up being mad at them for that. I don't want them to take on my pain or suffering. I would like them to be there for me more than they have been. But I understand that they're not. So it's okay to also seek out professional help in organizations. There are many of them. And you definitely need that third party to be able to talk to, because if you just do it with your partner, it is incredibly challenging.
Yeah.
And I think trying to find some way to honor the loss of your child in whatever way that's most meaningful for you. For my wife and I, that's still something that we're coming to terms with. I'm writing. I write a lot to my daughter who's alive about this experience and about her sister. And for me, that's been comforting to be able to help her. My hope is that this is not only something that's beneficial for me, but it will be something beneficial for her in the coming years when she's older. And that's been very cathartic.
Mm.
But ultimately, it's your burden to bear, and it will be for the rest of your life. My wife and I were sitting in her hospital bed, just watching TV. We had a lot of time to think because there's nothing going on. She wasn't going into labor. And The Lord of the Rings was on. And the line about, Frodo not wanting to bear the ring of a burden of the ring, and that it's too much. And then, come to realize that, he is the ring bearer and it is his burden to bear. And if you don't, no one else will. And my wife and I just looked at each other, and it's just like, that's what it felt like. That this is our ring. We were chosen. And I don't mean that in any other capacity than a terrible experience. And this is our future. And we must bear this burden. And we must do so with bravery and compassion. And so that's how I see it. Like, it's nothing that I can hide from. It's nothing that I can put under the rug or be ashamed of. It's going to be here on my chest as a golden ring that I will forever carry. And I'm grateful for that ability, as much as I don't want it.
Yeah.
And so, one step in front of another, one day after another. And I think to the extent that you can take your pain and try to empathize with somebody else who's in pain and relieve their burden, has the reciprocal effect of easing yours. And so that's what I would suggest for others going through this.
I'd just add that if there are friends of people going through this, give your friends who are going through this some grace. They may not be very good friends for a little bit. And it's not because they don't love you. It's because they're just going through a brutal thing at the moment. So give them grace. Yeah. I remember me and my wife doing some just dumb things to friends, being pissed at them for saying silly things or whatever. But it's just, you are emotionally so torn apart that it is just brokenness that comes to the surface oftentimes. And so just give your friends, if they're going through a miscarriage or whatever they're going through, especially when it's dealing with their kids, just some grace around that. And people who are going through this, I would just say, my wife, Mark, sounds like you and your wife as well. It's okay to reach out to people who are professionals at dealing with loss. This is nothing to be ashamed of. If you want to go talk to, a trauma specialist, a loss therapist, whoever it is. And especially, as guys, it's hard for us to do that sometimes, to kind of surrender some of those emotions to somebody that you don't know very well. And I was like, man, it was the best thing that I did. It was the best thing that my wife did. We did it together. We did it separately. And I think that was a key piece of the healing process. Because I think one of the really important things that you said and what our therapist has said is like, this is with you forever. This is not something that disappears. It is a part of who you are for the rest of your being. And so what are you going to make of that? You know?
Right.
Yeah. So, give these folks going through this stuff some grace. I would tell you the most difficult thing in the world, and, hopefully this can hit somebody, is we had to hand our daughters over to a nurse, never to see them again. We knew that we were never going to see our daughters again. And if you have kids and can recognize that that's what our families had to do, that is just the power of like losing a child. And so my thoughts, my prayers are with everybody out there who've lost children. I'm on Twitter. If you want to DM me, and want to talk, like, I'm happy to do that. I know Mark well enough that I'm sure he'd be willing to talk to people, as well. And, just kind of full transparency here. Mark and I started our podcast talking about how broken healthcare was. And I said, you know what, dude, like, they can hear this from a million different places. There aren't a lot of places with, a couple guys who've, lost their kids talk about how hard and difficult that is, and how the system treated them through that. So, brother, I appreciate your willingness to open up, be vulnerable about that. I'm hoping somebody's going to listen to this and it's going to impact them. Either they're going through it, or they might go through it, or they're having a friend who's going through it. And so, willingness for you to do that. Because I stopped the podcast. I was like, Mark, would you be willing to talk about this? And he agreed. So I appreciate it, brother. I think this is going to be, going to hit somebody that really needs it. So thank you for your willingness to do that.
Absolutely. And thank you for asking me. As hard as it is to talk about, it's one way of honoring Celeste. And so I'm more than happy to do that, to know that her name will live on through this, as well as Grace's.
Yeah. Thanks again. Where can we find you? Oh, one other one, Sovereign Health. It's an awesome book. We want you to go and read it. You can find it on Amazon, right? That's where I think you sent me mine. So I feel special, but you can get it on Amazon and other places. And so go out and get it. What, Mark, is 150 pages, something like that, plus or minus?
Yep. It's a quick read.
It's 150 pages. You can get through it in a couple sittings. And I don't know if there is a better, more kind of concise place to go, hear or read what's going on, what's Looney Tunes about our healthcare system. And as I told Mark in the first half of our thing that we now have probably deleted, that, a lot of people can say it in 500 words, but he did it really, really effectively in 500 pages. You did it really effectively in, 150 pages. And so Sovereign Health is the book. Go out and read it. And then where can they find you?
I'm on Twitter, Mark, MN_local. And I'm also at Sound Lifestyle Medicine. It's a new virtual lifestyle medicine practice that my colleague and I have started up, where we provide lifestyle medicine services for clients interested in making some of these changes to their health habits and to avoid seeing me in the hospital. And so we offer, an intensive kind of program where we go through all these lifestyle factors: nutrition, exercise, sleep, stress, and how to optimize those for a healthier life. And we also offer consultations. And currently we're just offered in Colorado, Minnesota, Wisconsin, but actively getting licenses in Texas and Illinois. And we'll have some courses out here soon. So again, Sound Lifestyle Medicine, it can be contacted there as well. So, and I also want to second your statement about reaching out to, if you're going through something like this, please email or DM. Be happy to talk about it, because that's ultimately one of the best ways of handling it.
Dr. Mark Stephany, thanks, brother.
Thank you. This was wonderful.
Talk to you soon.